Okay.
Hi, it's Jerry. We're talking today with Kristen Sneddon, council member from the 4th District in Santa Barbara. Welcome. Thanks for coming.
Thank you.
Everybody healthy at your house?
We're healthy. We're good. How about you?
Yeah, everybody's fine so far. I haven't been out since March 5th. I went
Good
to
for
the
you.
women's political committee. I guess it was the 6th lunch, and that was the last time I was out. So, but you know, I'm such a misanthrope that I don't really miss going out. I kind of like
The
just,
same. Same. We're a household of introverts, and I think we're doing okay with that.
but you're working.
I'm working. Yeah, I'm
So you're
still.
teaching online?
Yeah, we're still doing the full load of classes, and we have been transition over to online. And I really give the students, they're really flexible and went with it and are showing up, and they've had to adjust their whole way of learning, and they miss being on campus. They miss each other. They miss
Yeah.
the community.
Well,
Yeah.
we'll do another show about how effective that is, because I have theories that we're all doomed from an education perspective.
Oh,
Because,
I have some thoughts on that too,
yeah,
but more hopeful.
of course you
Yes.
would. Okay, the county public health agency and resources are in charge of the pandemic, the medical piece. But what's the city's role? Doesn't the city have some important role here as well, particularly given the recession that is already upon us?
Oh yeah, I think the city has a hugely important role. I mean, first about the public health portion of, even though the county is our public health arm and gives us advice and advises us, I think as a city, we have the ability and the responsibility to see if we want to go farther than their recommendations. I don't think we would ever go less than their recommendations, but if we wanted to be more careful on something, or handle our beaches differently than the county beaches, or handle our parks differently, or our trails, there are definitely policy issues that the city can look at differently, with our densities being different and just our community being different. So for the public health part, yes, the county is, in terms of their recommendations for how to handle things, but we could always go further if we wanted to, and we should always be looking critically at the information that we're getting, and if we're getting enough
Well,
information.
I'm curious. I mean, at what point did the light bulb go on for you? Because I think people kind of realized the seriousness of it at different points. We had a big cruise ship that was supposed to be coming in, and there was some question about whether that was going to happen. How did this all settle on you?
Well, for me, it really did start with the cruise ship. I mean, I'd been following it somewhat, and when the cruise ship was coming and people started writing us saying you really shouldn't let that cruise ship here, and we started internal conversations. I know one of my big questions early on is, why are we going to wait until after the cruise ship is here and we have our first case before we say, oh yes, cruise ships are bad? We should be looking at learning from China, learning from other areas and what they've already gone through, to say, we know that cruise ship is coming, we know the eventual outcome of that, how about we head it off ahead of time? And I think that's where county public health, they do such an excellent job in so many things, but for community to protect it, anything preventative like that, I just want to be more proactive, and the trigger points that the county needs to wait for, we can be a little bit more flexible than that and look ahead.
Do you think we're not doing anything that we ought to be doing from a public health perspective?
Well, I mean, it, it's tricky, and I can only speak for myself, because we've got the full council and people have different ideas. I really think that everybody should be wearing masks outside. I really think we should be limiting the number of people on the trail. I think every grocery store should have a unified, a consistent way of managing the number of people in the store and how they're protecting their workers. It's not just about protecting the customers, but also the workers who are there every day. They've really become frontline responders to the crisis, and they need to be looked after too.
So as a policy matter, do you have a pathway for making that happen?
Well, this is where, we can influence, we can ask, but this is where something, if it's not coming from county public health, or it's not coming from the governor, who I feel is doing an excellent job, by the way,
Yeah.
it's a little bit harder to mandate those things. And then we don't have the enforcement capability right now to really push that through. So policy things we can influence, but yeah, I mean, I think I always think we could be doing more, and there's a fine line. I mean, people are already doing so much.
Well, I think the area where a lot of people are wondering about, obviously, is in terms of the economy,
Yeah.
which has been shut down for 4 weeks now. I think the city has a big role to play in that. Particularly, we have a new economic development director. We already had this, big problem downtown and with State Street. But I hear this narrative growing about, where's City Hall? What's going on? How come everybody's MIA? Is that a fair criticism?
Yes, it's a very fair criticism. And it was a fair criticism before COVID. It was a fair criticism since the Thomas fire. It's been a fair criticism since then. And I do think we were making some pretty good headway and progress. There was that really big moment when we had the 25 recommendations from the business community, and we immediately took those recommendations.
The Cosmont report, is that what you're referencing?
Before the Cosmont report, when we had the business leaders coming together on their own and coming up with a list of what we needed to do immediately, and we really took that to heart. And then the Cosmont study, and then the hiring of the economic development director, which is a brand new position, and what a time to be coming in.
Welcome to the NFL.
Yeah, but also perfect time to come in. I think we're most poised right now to not just continue business as usual. We just can't go back to status quo. We need a whole new paradigm, and we're not going to get there by just doing what we've always done. So maybe this is just the perfect time to come in with this new paradigm and really look at the whole system.
Well, what does that look like? I mean, the Montecito Journal has a cover story this week about this very issue, about the disconnect between City Hall and the business community. It talks about how there's a private public task force up in San Luis Obispo that's, planning what are we going to do, how are we going to roll this out. I don't see anything like that here, is there?
Well, no, that's why we have this new economic development director. I mean, he's 2 weeks on the job. He's gotten onboarded, and we're going to meet him officially, publicly, as a community on Tuesday's meeting. Tuesday's council meeting will be all about our economic crisis and the beginnings of what we're looking at, and our budget also. I mean, we also have some really basic infrastructure, like, water running and utilities that need to happen, solid waste. I mean, there are also some pretty basic city functions that still need to happen. But he's just come on, and I say to, like, Montecito Journal, bringing this up front page, keep it up. We really need that public pressure. We really need to be held accountable. I can't tell you how much I welcome that this is a community conversation. There are things that, I know you've heard me say for a long time that there's some things that are really broken, and this is the chance to just break it down and rebuild it in a way that works for our new realities. We're just in a different place than we've ever been, and that has been since the Thomas fire. And this just really highlights where our weaknesses are and where we really could see some just new vision,
So bold structural change. You're
bold structural change.
Okay.
But we still want to be Santa Barbara. I mean, I don't want to be a big city, and I don't want to have our interconnectedness be all online. I mean, we're a really special place, and I don't want to just borrow from other places. We need to start it from inside out with who we already know that we are.
On March 24th, the council voted 7-0 to put a moratorium on evictions, but you were, in the words of the great Josh Molina, visibly anguished by the vote. And you talked about the domino effect of that and the pain of foreclosure. What were you concerned about? What were you anguished about at that point?
Well, I don't, we can't have evictions right now. I mean, that's just public health standpoint wise. We can't have people moving around, and it's very difficult for people without jobs and not to pay. My anguish on that wasn't the moratorium on evictions. It was on having this open-ended idea of how the repayment would happen. And there are a lot of issues when you don't know what the repayment plan is. So a property owner, I mean, say there's a moratorium for however many months, if they then know what the repayment options are out of that, you can budget, you can work with your bank, you can work with your mortgage holder. I'm concerned for all the parties. I can't have evictions right now. My anguish about that really was, if you leave it so uncertain that just, well, you don't have to pay it now, and at some point later it'll be repaid, but we don't know, and leaving it up to the parties to negotiate it themselves. It's not that easy to negotiate on your own, and people have really different ideas about timelines and what that could look like. So I'm concerned about the mom and pop property owners and what's going to happen with their mortgages. But I think now we really needed the state to come in and say, or the federal government, I guess, to come in and say that banks work with them.
Yeah, we're kind of screwed, because at least so far the federal legislation has been aimed at local communities of 500,000 or more. We're just under that, obviously, with the county, and the cities under 100,000. So, Paul Casey, the city administrator, said already the budget's going to be, quote unquote, a disaster.
Yes.
What are you thinking that's going to look like in terms of services and layoffs, taxes, and so forth?
The budget is going to be a disaster. I mean, I think it's well, that's what it is. The budget that they've been working on for 6 months to present to us is based on an old reality that isn't going to come back, I mean, for a while. So things like enterprise, if ever, yeah, yes, let's hope for a consistent recovery over time, and hopefully we'll get there. Some of the enterprise funds that are make their own revenue and then spend their own revenue, their budgets are different. But you've already heard about downtown parking. If there aren't people parking and there isn't revenue coming in from that, then you can't support the employees who work in the parking lots there.
And Tom Bolton has a story today at Newshawk. 95 traffic at the airport is down 95%. I mean, another area where, how do you get a handle on that? Do you think that the city has done enough under the current conditions about homeless people? I know you put the 8 bathrooms out there somewhere, and there's, I keep hearing about this 68-room hotel, but have we done enough? Is that still a problem?
Again, it's never enough. I mean, that is the question with that. I mean, as long as we still have homeless people on the street, or our neighbors experiencing homelessness, it's never enough. I will say that we are in really great communication right now with the county and with other service agencies, and in being really coordinated right now. And that's one thing about a disaster that brings us together. We have these legislative calls where we're all hearing from each other and what other agencies are doing. And then when disasters pass, those fall to the wayside. And it's one of the things that I really appreciate during these times, is how coordinated we are. We're on the same legislative calls with county representatives, mental health representatives, Congressman Carbajal and Senator Jackson and Assembly Member Limon, and hearing all the different concerns, mayors from other cities, and hearing what other places are doing too. So homelessness specifically, we're doing a lot, but as long as there are people, under CACIC pass and places gathering together and really jeopardizing their own health, it's a problem. And we've had rain and bad weather, but the resources, well, what should I say?
What about in terms of the pandemic though? I mean, in San Francisco, they had this enormous outbreak of the virus in a homeless center. I don't know, dozens or scores.
Well, that's the problem.
The
CDC says, it's better not to move encampments because you're mobilizing people and bringing them closer together. And then you have this question of, do you put people in congregate situations where they're not separated far from each other? You separate them enough, but then you have bathrooms and hand washing. And the main limitation right now isn't space or places, it's the staffing and the volunteer help that's needed to actually care for the needs. And so it's a human shortage and not really a space shortage. We have the spaces. They're already lined up, they're already approved, they're rolled out, they're ready.
Is this the hotel you're talking about, the 68 hotel rooms?
Yeah. It's a tiered approach. There are different tiers for different numbers. We're not likely to get up to the 5th tier.
Okay.
It's available and but it's the people staffing and volunteers. They need quite a few volunteers to bring that about.
What about the increase in crime that the police chief talked about? What's your take on that? What's happening and what can be done about it?
We're seeing it. I'm sure you've seen it or heard about it. There's definite uptick. We're stretched pretty thin. It's just how it is. And with each call that the officers go on, they're exposing themselves or exposing others. It's you have a lot of younger people who aren't in school or aren't employed right now. It's not necessarily younger people, but people are hitting hard times, and petty crimes are going up, but also sort of the pent up feeling and a little bit of uptick in violent crimes too. I think
we had a shooting on the east side on Easter. So what's being done about that? So are you saying when we're stretched thin that there are a lot of officers who are out with the virus and we don't have enough?
No, it's just so much enforcement. There's so much enforcement that needs to happen on a broader scale. I think we have one officer who's tested positive and is recovering at home. So it's not that the illness is taking it out. It's just that there's much more to enforce and to manage. And you don't have whole groups of people at school or whole groups of people at work, or, there's just sort of more to look after, and tensions are higher, and people are a little bit desperate.
Just going back to the budget for a second. So the city's already laid off hourly workers. How many people got laid off already?
I'm not sure the number. It's somewhere between 300 and 400.
A couple hundred. And all the hourly workers, people who work for wages, don't have benefits. Do you think that the top salaried people in the city should take a cut in salary now, if nothing more than as a demonstration that we are in fact all in it together?
They're definitely looking at that. Everybody's going to see what they can do. Each department, definitely department heads, and I know there's a petition going around. It arbitrarily asks for 30%. I'm not sure where that number exactly comes from, but yeah, I mean, we're
So you
we're
think that
all,
ought to, you think that ought to happen?
I think we have to look closer at whether it's that 30% and who that affects, but yes, I mean, I think we got to share the pain. I think it's,
What's the number one thing that you're hearing from constituents about, the number one thing they're concerned about?
um, it just really, people are concerned about how well other people are following the guidelines. So we get a lot of concern about, I saw this many people on the trails, and then I think, well, you were on the trail to see that many people on the trail, right? And concern about other people at the beach and other people's dogs, and a lot of that. I don't know that that's the biggest concern. The economic, I mean, we all see it coming, and it is going to hit different people hard in different ways. And I think the economic concerns are definitely looming right now. People are scared for their health, and yeah,
Yeah.
the economics.
So you're a scientist, and you know and understand that this really isn't going to be quote unquote over until we have a vaccine or until we've established herd immunity. And that period of time is, I've seen estimates from 11 to 18 months, whatever that is. So the question for policymakers such as yourself is, how do we manage what's going on forward? At what point do you think we should begin to quote unquote open the economy up? Do you think, I mean, just give me a ballpark. You're talking about the middle of May, August, Thanksgiving, which is another estimate we've heard. I mean, where are we going to be in 30, 60, 90 days?
I think there are a couple things inherent in that question. One is models are only as good as their inputs. And right now, we don't have constrained inputs. We don't even know, until we have testing, we don't know how many people have been exposed, how many people have it, what kind of herd immunity might even be possible, if it's possible.
We don't have a denominator.
We don't have the input. So the range of variability and error bars that we have on those inputs are too large to have constraints so far. And I think we're going to get tighter and tighter in it. So when will we actually get testing? The last I've heard, it's several weeks out before we might sort of mass availability of testing. We're able to get a handle on what we have and with. So there's that. What does it mean to open up the economy? I sort of have an idea. It's not just my idea. It's not new, but there is no new normal. I mean, in mind, there's no normal anymore. I mean, no new normal lasts for very long, and so I think needs to fundamentally change. I think as we're like home and realizing that shopping might not be as important to us, a different, we're stimulating the economy or using money. Opening the economy is a really tricky question. I think a huge paradigm shift in what is education. What are we hoping to get across to our next generations? What skill are they going to need to have? Don't even know they need yet.
And what is our
Nimble.
economy? What is the economy of the city going to be based on? I mean, we've got tourism, we got retail, we have education. Okay, we can do that, but you know, how is that? What does that look like going forward? It's all very scary.
We need to be nimble. That's the bottom line. I mean, we need to be nimble in everything we're doing day to day. Our students to be nimble in what they expect, whether they're going to graduate or not, or start college in the fall or not, or they receive education. We need to be nimble in how we expect to receive our services, how we shop for food, how we interact and socialize with each other. And so opening the economy, I don't see as a one-day event, rib cutting of we're wide open now. I see it as shifting and changing in what it is we offer. I mean, what I can think of is, I think it's Handlebar Cafe. And so now they sell coffee, yes, also like a bread starter and flour and toilet paper. So you can pick up those essentials at Handbar and changing what needs they're being. And that's sort of a just a little example of how shifting, but it won't open all at once. I think some people will adjust and in different ways. I mean, another thing, just back to education for a sec, there are students who are planning on going to college in the fall, and they were talking to me today that they can't work over the summer to save up the money they need for the fall so they don't know, are they even going to where their acceptance letters from and where they've already accepted admission to, are those even going to be open in the fall? So to answer your question, there are points along the way. I think our trigger point is after, I'm going to say about 3 weeks, 4 weeks before we get maybe large scale availability of testing. Then you have to let that data percolate a little bit, and then hopefully targeted, some people will be more able to move about freely and in the economy, and we go from there. But long range planning, the way we experience is going to be different. It's just I think we're all doing some soul searching while we're home, and I don't know, I'm really enjoying with my own family. I think a lot of people are experiencing too that they might not want.
We're gonna have Fiesta.
Don't know. It's hard for me to imagine that we could congregate that number of people. There may be some type of virtual Fiesta. I don't know. I mean, there's a lot that for the first time ever in our memories is not happening, and it just may be that kind of year.
All right, that's a good place to leave it. Kristen Sneddon, thank you so much for taking time to talk to us. I know that you spend most of your life on Zoom now, don't you?
I do. I just sit right here. Can I just tell you a funny story though? Yeah. I was Zoom meeting with the college staff, and I was sitting out here on this chair, and I backed up a little bit and just fell completely off my deck, rolled down into the rock, and I came back, Jerry. He had noticed I was gone. Out of the view.
There's no video of that. There's no. We don't have any.
I'm.
Footage?
I'm sure the host of the meeting probably has it, but it doesn't go anywhere. But nimble. We need to stay nimble. That's the.
Right. Thanks, yeah. Kristen.
Good to see you.
Good to see you too. Stay well.
You too.
Bye-bye.
Okay. Bye.